Welcome back. It's time now for our African Health Network update, and Lino Madu is here with today's report. Hi, Lino.
Hello, Dimiake. Hello, everyone. Well, the European Medicines Agency, Europe's top drug regulator, is recommending approval for the first vaccine against meningitis B made by Novartis. There are 5 types of bacterial meningitis, and while vaccines exist to protect against 4 types, none has previously been licensed for type B meningitis. Novartis also is seeking to test the vaccine in the United States. The United Nations recently announced that the world has met its Millennium Development Goals target on access to safe drinking water. But the world is still far from meeting the MDG target for sanitation, and it appears unlikely to do so by 2015. Experts say there are currently over 2.5 billion people are living without adequate sanitation. Illnesses that are a direct result of poor sanitation affect the quality of life of millions of people worldwide, especially children. Sanitation coverage is lowest in sub-Saharan Africa and South Asia, where 70% and 59% of people respectively do not have access to improved sanitation. World Toilet Day was commemorated yesterday with the aim of drawing attention to the global sanitation challenge. For more perspective on the growing need for better global sanitation, we are joined by John Oldfield, Director of the organization WASH Advocates. Mr. Oldfield, welcome to the program.
Thanks very much. Happy World Toilet Day.
Thank you. Well, obviously sanitation is a problem globally, but why was it important to dedicate a whole day for toilet?
Well, it's important to dedicate every day. Every day should be World Toilet Day. There are 2.5 billion people on this planet that today, in 2012, do not have access to a place to go to the bathroom on a daily basis. There are 1 billion people without safe drinking water on a daily basis. Imagine what it would be like to go through even one day suffering from a lack of either sanitation or safe drinking water. You pull these two things together, and over 2 million children under 5 years of age die each year from inadequate sanitation and unsafe drinking water. The key here is that those deaths are preventable, and sanitation coverage in Africa, in Asia, and Central and South America is a big part of the solution.
So then tell us about some of these solutions, and specifically what is there that needs to be done?
Great. Well, I was in Rwanda just a few months ago talking with some Rwandan friends of mine, and like everybody, every human being, I was bragging about my new cousin Madeline. Madeline had just turned 1 year old, and I was showing a picture of Madeline to my Rwandan friends, and they were shocked that she was only 1 year old and already had a name. And I realized later on that a lot of families, a lot of mothers in Africa, in Asia, in Latin America, don't give their children names until they're 2, 3, 4 years old, because so many of these kids die so early from easily preventable waterborne diseases. We need to use World Toilet Day to raise awareness of the gravity of this problem. We need to use World Toilet Day to raise awareness of the solvability and the solutions. Solutions vary depending on the local context. A solution is a ventilated, improved pit latrine to properly dispose of human waste. A solution is a community-led total sanitation, whereby it's a behavior change approach to encourage people to stop defecating in the open and build their own latrines. There are solutions underway to process human waste and turn it into fertilizer and biogas that has real commercial and agricultural appeal. There are a lot of solutions. Depending on the context, one is going to be the right one.
So obviously then the MDGs on sanitation will not be met by 2015, but what do you think it will take, even if we don't meet it by 2015, at least closer to that date later?
Yeah, that's exactly right. At the current rate of progress, the world will not meet the Millennium Development Goal for sanitation until sometime in the second half of the 22nd century. Unconscionable. The world has never been richer. We've never been more powerful. It's quite an amazing feat to be able to solve this challenge. We're asking our friends, our partners in the developing world to go to keepyourpromises.org. That's a website. It offers campaign materials to help those governments keep their feet to the fire, to help those governments, to pressure those governments to meet the commitments that they've already made for both sanitation and safe drinking water and hand washing with soap.
And in 10 seconds, what is the key message then?
The key message is that this is a grave problem. but it's entirely solvable. We know how to solve the problem, and every one of your listeners and viewers can be part of the solution.
Thank you, Mr. Oldfield.
My pleasure.
Great. And that was John Oldfield, the director of the organization WASH Advocates. And for more information on today's topic, you can join us on our website at africahealthnetwork.org.
Thanks, Lenore. For our audience, please be sure to watch Lenore Madu's informative Africa Health Network reports every Tuesday and Thursdays, right here and always on In Focus.